Hi Kelly, how are you going? Just before we go in to see Jack in room 10, I just want to let you know he's been very teary today, quite emotional, a bit apathetic, definitely some situational low self-esteem because of his stroke. And I've just been giving him a bit more of my time, alright? His two sons are in the room with him. Definitely some caregiver anxiety there, just about the future cares and that. I've been educating them, involving them in his cares. We've been setting some goals together about helping him with his care, okay? Just to build up some confidence. And the social worker's going to pop up and have a chat just about their fears and stuff this afternoon, alright? So before we go in. Hi guys! Myself and Kelly are just going to do our handover, just doing my hand hygiene, okay? And Kelly's going to be looking after you on this afternoon shift, alright? So these are Jack's sons. You've been a fantastic help today. Well done, guys. You've been really fantastic helping Dad, alright? We're just going to quickly check your ID band, Jack. Yeah, and your date of birth, your URN. You haven't got any allergies. No known allergies. That's fabulous. Okay. Kelly's just going to do a quick safety check. If you see Kelly doing any writing, that's just she's taking some notes, alright? Okay, guys? So are you happy for your sons to stay in the room? Lovely, Jack, and if you've got any questions or anything, just feel free to use that tablet like we've been doing all day. Lovely job, okay. So Kelly, Jack Jones is a 55-year-old gentleman. He's day 5 post an acute ischemic stroke. Following that stroke, he did have some heparin, IV fluid, and he had other IV fluids as well. They have since been ceased, okay. He's experiencing some expressive and receptive dysphagia. He has been very determined to get back to full health, and bless him, we were a bit over-determined this morning and he did have a fall. I've updated his falls risk assessment with the heparin having been withdrawn, and also because of the fall, and he's now an 18, alright? So that's a high falls risk, and he's 1 assist with his frame. He's a high risk of a pressure ulcer because he does have a reddening on his sacrum, alright? We had an episode of ICP 3 days ago. That was secondary to a TIA a week previous to his admission. I've been continuing with neuro-obs and there's no deterioration in LOC, alright? We do have a history of type 2 diabetes, hypertension, osteoarthritis, and Jack is a smoker. I did give him a Nicoderm patch this morning just because he was been so anxious, and that's really helped him a bit today. His regular meds are amlodipine, Avapro and aspirin, and also some paracetamol for his osteoporosis. I've checked with Don't Rush to Crush, and they're all suitable for his NG, okay? His last neuro-obs, we had a GCS of 13. That's a really good improvement. That's a really good sign, guys. Still some general weakness and some vision issues. The OT did come up this morning and did a vision screening. Some signs of hemianopia. So that's what I was saying, Jack, was your half vision, alright? So I've been keeping all his belongings on his right hand side where his vision is best, and also just making sure to keep the lights nice and bright for him. As you can see, Jack is using a tablet to communicate, so if we can just make sure we give him enough time to understand and make sure he's taking in and can ask questions and is understanding our procedures and stuff, that'd be fantastic. The last BP we did was a systolic of 150, which is pretty good with a history of hypertension and that raised ICP lately. I've just pop some DVT stockings on, obviously with the issues around mobility and also with just help with circulation, okay? We did have a very big chat today about smoking, and I'm definitely keen to bring down the levels of the patch and maybe cease the patch at the end of the week, okay? The nutritionist and I had a chat today, and Jack, we're going to start you on a DASH diet tomorrow just to bring down your sodium levels and help with the hypertension. There's a cannula in his left cubital fossa just over there, okay, his right cubital fossa. It's day 3 of that one. It's patent, no signs of infections, but I definitely think we might want to review it as it is day 3 if you want to have a look at that, Kelly. Levels with the resps are within the flags. We've got a resp rate of 16 and saturations of 96. I've been just keeping the bed up just to help with his work of breathing, and we've been setting some goals of doing some breathing and coughing exercises 3 times a day. The boys are helping with that, just to help relieve some stress and also obviously to prevent aspiration. I did a full respiratory assessment this morning, no advantageous sounds and no signs of obstruction, just suctioning whenever necessary. I've asked the MO and the speech therapist just to have a review of the NG tube now that his ovular deviation has resolved. Okay. Jack remains nil by mouth. Diabetic NG feeds which are being tolerated really well. As you can see on the paperwork there, he was commenced on an insulin sliding scale yesterday. These levels have been falling. I've been titrating it down to 1 unit per hour, just as per the order, okay? And the dietitian is going to come and see us today, just about maybe trying to organise a food plan that addresses the diabetes and the hypertension, all right? And obviously if the NG tube gets removed, we can maybe start on some solids and see how they're tolerated. Jack is continent of urine and of feces. Good, bowels open this morning, good urine output. Just needs to remember to bring the jug with him to the bathroom because we're still keeping that chart going of in and out. Just want to make sure that he's getting everything he needs, and we're continuing on daily weights with the NG tube, with NG feed, okay? The OT has given Jack a frame that he needs to remember to use to get up and down. He just keep that balance in the pelvis, but we need to encourage Jack to use it, don't we, Jack, okay? Active and passive ROM movements we've been doing all day just to build up some strength on that affected side, and the boys have been really great at helping with that, which has been fantastic. OT will be going to the house tomorrow just to do a preliminary examination of the house to see what's necessary, okay, for get Dad ready to go home. The reddened area on the sacrum looks like a stage 1 pressure sore to me. I've done a full skin assessment of the whole body, no other areas of concern. If you just want to have a look at that there, Kelly. We've got a water low of 15, 2 hourly moves is what I've been doing just to keep that pressure off, and obviously just keeping the area nice and clean and dry. And the boys have been helping Dad to transfer and everything, so he's moving around a good bit. I've popped a foam wedge in on the left hand side there, just to, because he's had that tendency to droop to the left. And I've also popped an overlay on the bed just to help with any other areas of pressure. And there's been no signs of a recurrent cellulitis that was in his notes, but just keep an eye on that to monitor it, okay? Looking into the next shift, just keep the OBS TDS. I definitely think we need to see an optometrist in the next few days just to see what those vision issues are. And we're going to follow up with the speech therapist and with the MO just for a review of that dysphagia screening, okay? The diabetes education would be great if they could pop down and just tie that diet and exercise education together just to prevent any issues around the hypertension and preventing a secondary TIA. The chip nurse is going to come down and chat to the boys about the different things that are available when they get Dad home. Home help, NDSS, community nurses that are really going to help them when he gets home, okay? Also, the boys have been a bit confused about the medications, so I think the pharmacy could come in and just talk about the blood pressure medications and that would be really good, wouldn't it, guys? But overall, we've seen some really good signs of improvement today. You should be really proud of yourselves, guys. Some really good signs. Have you got any questions, Jack? Do you want to clarify anything for us? Kelly, are you happy with that plan of action? Have you noticed anything in the notes or in the charts? Everything signed off? All good? Well, I'll just give you your call bell. Your belongings are there. Thank you so much for letting me look after you today. All the best, guys. And my hand hygiene. Lovely. Thank you so much.